All right, the hot topic, that is vaccinations, and parents have very different ideals and beliefs on how that should go down or what they want to go down. What are your feelings on that when a patient or when parents come to you with perhaps altering views than maybe you have?
So I will tell you what I believe in, then I'll tell you what I do in practice.
Okay.
So I said I'm very interested in preventive medicine. So to me, vaccines are the best proven, known way to prevent disease. So am I pro-vaccine? Yes, I am. Did I vaccinate both of my children on schedule? Yes, I did. And I wouldn't recommend anything to anybody else that I wouldn't do for my own child. And that's how I approach everything. That being said, I know every child is not my child. And like I said, it's a team approach, and we have to work together so that we can treat your child in your wishes. So we work together. So my job is to explain to you every disease and what I'm trying to prevent, or what, as with the vaccines, and then you do, which everybody does, their own research, and you come up with your beliefs, and we discuss it. Because like I said before, if you can't have those open lines of communication, there isn't anywhere to go from there.
Mm-hmm.
So I think by doing that, we can maybe come to some terms. The only thing, and different doctors are different with that. So in terms of their beliefs, and it's not, I think with anything, there isn't, for me, a my way or the highway kind of thing in terms of vaccines. I would like to vaccinate your child, obviously on schedule, because that's my personal belief, but I want to vaccinate them also in a way that makes you feel comfortable sleeping at night. So, and everybody has different issues with vaccines. So I always ask a person, what is your concern with the vaccine? Because for some people, it's the number that you give at one time. For somebody, it's what's in the vaccine that bothers them. So every person has that. You can't just lump everybody together and say these people, they're for it or not. And I want to know what is your individual concern about it, so I can address that from an educated standpoint and explain why, explain things so that it makes sense, mm-hmm. and that we can come to an agreement on what's the best for your child. Mm-hmm. So that being said, for people who choose not to vaccinate, there is a form that's from the American Academy of Pediatrics that says that I have recommended these vaccines and you are choosing not to do them. So I personally have all my patients who choose not to vaccinate, and it's not even just all of the vaccines. It's if I'm recommending one and they don't want to do that one, I will have them sign that form that says I've recommended that one and you are choosing not to do them. Because I feel like it's not my form. This is a form from the American Academy of Pediatrics. That's a standard form. I can't change the wording on it. Mm-hmm. If you are not wanting to vaccinate your child, then I think you need to accept the responsibility for not vaccinating your child. And I will ask you to sign that form.
You've got parents that are perhaps probably struggling back and forth, or at least having a long conversation, mm-hmm. and parents have a lot of questions. Now You're going over your time perhaps with this patient, you have another waiting for you. How do you handle that?
I apologize to the next patient. That's pretty much what happens. Yeah. If somebody's really sick, it's a doctor's office.
Yeah.
You just have to take the time and just explain to the next person, I'm really sorry, if it was your child was sick, I would spend just as much time with you. The next time, we can't control really what happens here. For the most part, we try to stay on schedule, but also giving each person the time that they need, mm-hmm. so that you're listened to. Yeah. That your, whatever concerns are addressed. And then, if you can sometimes do that in the beginning, then it gets shorter the next time because there aren't as many concerns, and you know how to use the phone calls and the email and those kinds of things. Yeah. So I think that you
just refer them to the portal, right? Those would be perfect questions to just send
It depends. Sometimes people want you to look at, but sometimes, rarely, but sometimes they'll say, I really want to address this issue with you, but that's a really separate appointment, especially like behavioral visits and things like that. They take a long time.
Okay. So anything else that you wanted? Anything that's pan back to any other visits that you've been like, what? Or who? Where? Why?
No. Not that I can think of.
You can walk away from this being like, all right, I get this. I get Facey. Mm-hmm. Why I would want to come here or not.
Yeah. Only if Dr. Lubin can be our doctor.
Yeah.
That's how you end. That's how you end. You're hired. No.
All right. there are my questions. All good. I think we're set. Thank you so much, Dr. Lubin, for taking
You're
the time
welcome.
again. It was awesome, enlightening, learned a lot, and yeah, I don't know.
Well, thank you for coming. I hope it was informative and that you'll eventually become Facey patients and my patients.
Yeah.
Well, Alex will. You're a little old.
Yeah. We're like, we just come
You're
crawling
over
in
18.
like,
I'm not allowed. No,
can I get a lollipop?
Right?
no lollipops. I can't give out candy. That would be, hypocritical.
Yeah, there you go, there you go. Yeah, exactly.
Stickers.
Yeah, I
Oh,
like
well,
it.
thank you for your
So-
time.
Yeah.
You're very welcome. Thank you for coming.